That's a tough question. I mean, I think that first and foremost, it's safety. It's healthcare worker safety. It's realizing that providing critical care in that environment is somewhat risky for the patient just because we can't intervene as quickly as we would in the regular intensive care unit. So planning for that so that you have backup plans in place for things that might happen, such as a self-extubation or similar issue. But healthcare worker safety, I think, is the most important thing, in making sure that you do not spread this or you limit the chance that this spreads to any of your colleagues.
Yeah, I agree. In almost all of the care that we provide, the attention to healthcare safety is usually minimized, and it's not usually at the same level of decision making as you consider a patient's outcomes and what interventions to provide. I think quickly, if I had 1 minute or 30 seconds to talk to intensivists, I would let them know you can't just buy a widget. So the idea that in the last minute you can buy PPE and then that your people are going to just-in-time train taking care of critically ill patients is a non-starter. I would recommend to move that patient out of your facility ASAP if you weren't ready. The flip side is I think intensivists, critical care nurses, critical care pharmacists, respiratory therapists have a big role to play in terms of thinking through all the processes of care we do every day and modifying those for patient safety and healthcare worker safety. And most of the infection control people, hospital epi people, ID people are wonderful, but that's a different skill set. They're not going to be able to think about what's the safest way to manage the airway and put someone on a ventilator and what things should you do and not do. So I think it's incumbent upon the critical care community, if your facility is going to take on these patients, to assume that someone is going to get critically ill and you need to be leading in kind of process modification to make sure it can be done safely.